all, okay. First of all, good evening to everyone, and it's great to have you here. Okay. So I'll just do a very quick introduction about myself, and then we're going to talk a little bit about the program itself. So try to give you an overview of the program, the school, and the kind of everything basically you need to know about the program, and then at the end I'll leave the floor to you to for you to ask any questions you may have, any queries, any things that are not clear, and so on. So we'll use that as a sort of a part of the question and answer to clarify any issues from you. So my name is, if you say it properly, is Jorge Esteves, but as a Portuguese is quite complex to pronounce names. So Jorge Esteves is has been my version, the version of my name for many years. So I'm originally from Portugal, but I left Portugal 25 years ago. So been an osteopath and an academic for many years in the UK, 17 years, then moved to Dubai, Saudi Arabia, where I worked primarily as a clinician. And for the last 4 years, I've been with Malta ICOM, which is a school based in Malta, but still with a large infrastructure in Italy, where the school started originally. So I'm kind of, as I said, osteopath, been working in higher education for all these years, and I'm very active also in the field of research, and my main interests, and starting from my PhD, is in the field of neuroscience. Okay, so that's about me. So the important thing now is to know about the program. Okay, so as you can see, that's the name of the school. I think sometimes people may confuse us with the University of Malta. It's not the University of Malta. It's one of the institutions that actually operates in the Maltese territory. So the name of the school is Malta ICOM Educational, and started from when it originally opened in the kind of mid-1990s, late 1990s, as ICOM in Italy. And ICOM stands for International College of Osteopathic Medicine, and was a school of osteopathy for many years, with links with the UK, with validating universities from the UK, including, for example, University of Westminster, then the University of Surrey, and University of the Kingston University. Then after Brexit, the school decided to relocate and move to Malta and gain accreditation in Malta, and we'll explain a little bit about that in a second. Okay, so let's get this moving forward. Right. So from that time when we were a school of osteopathy, a lot of things happened, and we kind of looked at ways of developing within the field of healthcare. And since the school was opened in 2018 and gained accreditation from the Malta Further and Higher Education Authority, which is basically the Ministry of Education, that grants recognition licenses for first institutions to operate from Malta, and second accredits the programs that those institutions deliver. So we have a Bachelor of Science in Osteopathy, for 4-year full-time program, a Master of Osteopathy, which is 18-month program, which is the program we're talking about today. Typically, the full-time students follow the 5-year pathway. So they do 4 years, and then they continue and do another 18 months, and they graduate after 5.5 years as osteopaths. And then 4 years ago, we also started the Bachelor of Science Honors 4-year full-time in physiotherapy, and we have a very large French cohort and a large Italian cohort as well. And we have a Bachelor of Psychology, and more recently also a Bachelor of Dental Hygiene. So that's us in terms of the provision. So we have around 800 students between the different programs. Traditionally, the osteopathy was the larger provision, and currently that's kind of starting to be sort of overtaken by physiotherapy as becoming the main provision for the school. So we're based in Malta. The institution is in Malta with its headquarters, does have two campuses in Malta. That's one of them. So in Zira and Santa Venera. So Malta is a super. For anybody that doesn't know, Malta is a extremely small island, or in fact 3 islands, but the larger island is Malta, and with a population of around 500,000 people. And when we're talking about things being in different places, they call cities to every single place. But in a larger country, we would look at that as just a kind of a neighborhood, really. Is a small place, but it's not a city. But in Malta, traditionally, these things, you kind of you cross a road, you're in a different city already. It's just the way the country operates and has kind of developed over many centuries, and is one of the places where it's kind of very close to areas where very much the birth of kind of civilization. Okay, so around that area of the kind of Mediterranean, crossing over between Europe and the Middle East. So oldest civilizations around that area. So important points here, and I think that's an important thing that we need to clarify from the beginning when we're talking about this difference between a university or being a higher education institution. So the Maltese framework for higher education establishes 2 types of higher education institutions. A little bit like in some countries, you have the university and the polytechnic, or for example, the German system, and I think it's the kind of the Dutch Flemish system is similar, where you have the Fachhochschule, which is the sort of University of Applied Sciences, and then the university itself. So in Malta, there is a university which is an institution that is accredited to deliver all programs from bachelor level, so level 6, to master's level 7, and also level 8, which is doctoral programs. And then you have what is called a higher education institution. Some countries would call it, as I said, a Fachhochschule or a polytechnic. So it's licensed to deliver a level 6 and level 7 programs. So kind of bachelor degrees and master's degree, but it cannot deliver level 8 doctoral degrees, because that's normally requires a much larger infrastructure that's the higher education institutions don't necessarily have. So that's what we are. We have our license as a higher education institution. So it's not appropriate to call it a university, but it does not mean that the institution has the accreditation from basically the Ministry of Education, the Malta Further and Higher Education Authority, to deliver the level 6 and the level 7 programs. So what we're talking here about is a level 7, and the level 7 here is according to what is recognized throughout Europe since the Bologna process in 2005, kind of unified the structure for higher education with the first entry point, the first level, which is level 6, which is the bachelor degree, moving to 7, and then 8, the doctoral, the top. So this is the level 7, is a master's program, and is an 18-month full-time program with 90 ECTSs. So again, throughout Europe, you have 2 forms of master's degrees. You've got countries that accept both 18 months and 24 months masters. Some countries are very happy just to be on 18, and some countries really love just to have the 24-month masters with 120 ECTSs. At the end of the day, it's still a master's program, and providing is not a requirement, for example, to enter clinical practice or advanced practice in a particular profession that requires the 2-year full-time, the 120 is a master's program. Just to give you an idea of a country outside the Bologna process, the UK always, delivered a master's program full-time of 1 year full-time. And the UK system is 120 credits, which is equivalent to 90 CTSs. So you don't find master's programs in the UK, apart from maybe a specialism where it's more than 1 year. But in Europe, there's a sort of traditionally longer periods of time to sort of pursue a degree and so on. So that's what the process, the Bologna process, tried and to achieve was that uniformization, unifying a little bit of the way the different countries approached higher education. So that's to clarify how long it is: 18 months, 90 CTSs. So a little bit about the program. So what is the aim of the program? What are the aims of the program? So as a master's program, the first thing is, it's not a program about learning technique, because, ultimately learning technique is something that we, the competences you achieve at bachelor level. So it's a kind of how you enter a profession is by acquiring those competencies that enable you to really practice the profession, being safe in the case of a healthcare profession, be able to sort of technically delivering the care that you have to do, but also be able to think and have your clinical reasoning and so on. On a master's level, so what we try to do is start challenging a little bit, the style of practice, your belief system, getting you to be more critical, analytical, so be able to look at things from that sort of criticality. It's a little bit like, oh, this works, and the question will be, and really, how does it work, rather than just accepting as a kind of, oh, my teacher said it's like this. He is like, to try to develop those skills of really inquire, really, ask the bigger questions. So it's about the program that we deal, and we'll see in a second, we deal with some specialisms in clinical practice, but again, try to look at those specialists from this my practice and become an effective practitioner, more person-centered if that's the case, and so on. So the idea is really to develop this culture of looking at things from not necessarily just an evidence-based practice perspective, as you have to do what it says on the tin, by this meaning the research, but looking at things, how can you deliver the best possible care to your patients from an evidence-informed perspective. It's looking at when there is research, when there's evidence, use it. When there is no research, no evidence, be critical about, okay, what's the nature of that knowledge? How can I kind of, improve my style of practice and so on? How can I even contribute to the development of the profession? So for some people, could also be, maybe you are at the stage where you would like to push yourself a little bit further. It could be like, I know, for example, in the case of the Netherlands, where there's now a bachelor program, and it could be that having a master's program could enable people to participate also in the teaching. Okay, because again, if you're thinking about, again, the UK doesn't matter much, but in Europe, the expectations and the requirements, if you teach on a bachelor program, you should have a master's at least. If you teach on a master's program, you should have a PhD. So those are kind of the rules, and tend to be a little bit rigid, but also have a reason. The reason is you move up to the next level in order to sort of inform also your teaching. So it could be that people are kind of interested in contributing to the development of the profession. Could also be that people are interested in contributing to the development of the profession, even by engaging in research. And that's also possible through, the dissertation you do, where, can help, even contributing to new knowledge by kind of publishing a paper, for example, if the study, merits that sort of work. Master's program has entry requirements. The expectation is people have a bachelor degree as a way of entering the program. But if people don't have a bachelor degree and are osteopaths and have done, a valid program of study, meaning here equivalent of a level 6, equivalent to that bachelor. And typical thing is, people may have a DO in osteopathy, may have another degree. For example, it could be physiotherapist and have a bachelor degree in physiotherapy, for example. That will be an appropriate qualification to enter. If people only have a DO, but have been in practice for quite a number of years, then we can ask people to kind of submit maybe a portfolio of evidencing that kind of work you've done, how you developed as a clinician over the few years and so on, and that could be a valid way of entering the program. So it's not a kind of a yes, no. It's when you don't have that level 6, that bachelor degree, it's possible that actually we look at your profile and make a reasoned kind of make an evaluation about your profile and make a decision about if it is or not valid to enter the program. But just to give you an idea of where we are. The teaching on the program is going to be in English. Okay. So what the expectation also is a level of proficiency in English, so you can follow the lessons, but importantly also you can do your coursework and write up your dissertation and all that stuff without any problems. So how does the program look like? So the program, you see here core modules and elective modules. The thing is, there's an elective module that I didn't put here, which is osteopathic care in the field of in older adults, in geriatrics, because we're not running that. So in fact, all the modules are kind of core modules if you want to, take it from that perspective. So in fact, what you've got 5 modules in total. We start with the first module in the first teaching block, which is advanced clinical reasoning and osteopathic care. That runs in that first block, and then we then move on to advanced research methods, public health, and epidemiology. That module informs the dissertation by means of the research proposal that you do. Actually, it's the first part of the dissertation because we end up recycling the work you do for ultimately a research project. It doesn't stop there, and then you kind of move to another thing. Is a continuing, and I'll explain to you a little bit later. When we talk about the assessments, how that works. But that's second module. I'm just going to jump to the other 2. Then in the second block, alongside the research methods, you also have pediatrics, and then on the third block in Malta, you've got osteopathic care in sports and performing arts. And the final module is the dissertation. And the dissertation, what we do, when we start with the research methods, we start talking about the dissertation. We start, getting you to think about, possible ideas, possible research questions. Start working together, okay? Because what we do with the dissertation, we offer students the opportunity to actually work in pairs or in a maximum of a group of 3 people in developing the same project, work together, work collaboratively, each one producing their own coursework with parts that are actually common. Because, if I'm working with 2 of you and we decide, okay, that's our research question, that's our methodology, we agree on our methodology, basically the methodology is the same for the group of 3, okay? Because that's a collaborative project. And you submit that part of for example, the research proposal, and later on of the dissertation actually is common with the other 2 people. So there are parts then that are individual, like an introduction, but another part on the methodology that are actually common. So rather than kind of getting people to having to do the dissertation on your own, and you can feel isolated because you're in practice, don't have much time, and so on. So we encourage people to work together. Because that's also the nature of doing research. You don't do research by, thinking about having the big idea, doing everything on your own. So it's a collaborative project. Our experience, the running the program now on the 3rd cohort in Italy for the Italian students in Malta, but for the Italian students is actually works quite well. And we've got actually. Last month, we had one of the students, we got a paper published in Musculoskeletal Science and Practice. And last year, we had another student in the Frontiers in Neuroscience, in Frontiers in Psychology, we got another paper published. So this sort of collaborative kind of way of looking at things actually can lead to some very interesting things. So it's just sometimes, people get a little bit worried about, my thesis, that's going to be hard work and so on. So what I'm trying to get you to think about in a more relaxed way from the beginning is actually collaborative with your supervisor, but also potentially with a group of, another person or another 2 people, and, works quite nicely. And that's the way forward, rather than, in isolation. Okay, so how it's going to look like in terms of timetable. So I mentioned there are 3 teaching blocks, and in preparation for each teaching block, also you receive some pre-recorded lectures, on the topics related to the block. And the idea of giving you some pre-recorded lectures in advance is to avoid going to these teaching blocks and basically spend the whole time just doing kind of theory. Okay, so we do some of the stuff pre-recorded, send it to you. You watch it in your own time, and then during the there'll be basically 2 weeks of 6 weeks, 6 days per week. So 2 intensive weeks. The first 2 in the Netherlands, starting at the end of January, where we do a mixture of some theory, some discussion, some group work, but also try to get some practice done as well. And the practice here is not necessarily about learning new techniques, it's about looking at what we already do, for example, and let's think very creatively about, what, how does that work, for example? What's the mechanism? Apart from, of course, introducing to new things, but a huge component of this master's level learning is actually in a group environment together, kind of, developing the knowledge by kind of interacting with colleagues, interacting with the tutors, and start sort of challenging yourself in terms of belief system, etc., and sort of the way of moving forward. So first teaching block, advanced clinical reasoning and osteopathic care with some research methods. So as I said, we start getting on research from the beginning, and start getting you to start thinking about your research question from the beginning. So it's not waiting for, like, say, in 6 months' time, you have to think about your question for the thesis. No, let's get on, with that from the beginning. So there's enough time for us to kind of change things and so on. So that's the first teaching block. So I'll deliver quite a lot of that stuff. And there's a colleague from Portugal, Alexandre Nunes, that teaches, one of the undergrad programs in Portugal at Piaget, and also is one of the lecturers in the MSc program for the Italian cohort. And his field of expertise is pain. So his PhD was on nociplastic pain. So kind of a particular interest in the field of pain science. Second teaching block in June, still in the Netherlands, and that teaching block, you've got a combination of pediatrics to start, 3 days, then some research, some epidemiology, public health, and so on. And then the second parts of the second week, pediatrics again with Francesco Cerritelli. Okay, so again, you will have, so for example, from Francesco, there are 9 lessons pre-recorded that you receive, and that's a sort of the kind of more, theory, medical stuff, and things that are kind of quite important to understand in the field of pediatrics and neonatology. And then in the lessons, there will be an opportunity to really sort of do primarily practical work and some group discussion. And the final block in October next year is going to be in Malta. And the reason why we have to do some of this in Malta is because by the rules of accreditation, part of the course has to be delivered in the Maltese territory. Okay, that's crucial in terms of the accreditation of the program. So we can't just do everything in one country and forget about that. It's actually a Malta-based program. So with this program, we need to play at least with 50-50. And the thing here, 2 blocks are actually not in Malta, but the pre-recorded stuff is considered as online learning, and online learning, it counts at the time that actually is spent in Malta. Okay, so that's and then the final thing is will be in December, an assessment of clinical competence in the Netherlands. Now, when you see there, for those of you who have done a final clinical competence assessment, is a kind of a scary thing. Oh, this guy is going to test me in terms of, am I good enough or not? We will, with this case, we'll not have, we'll not do this with the real patient. We'll do this with simulated scenario. But the testing, the assessment of clinical competence is also one of the learning outcomes on the program. So we have to do it. And the other thing that I did mention here is, of course, we can't get you to go back to a clinical teaching environment, to the teaching clinic, and say, okay, now you have to do some supervised, a number of supervised clinical hours. However, what we want you to do is to look at your clinical practice. So there's a requirement that you look at your clinical practice, and you, by the end of the course, you provide at least with 25 cases where you kind of looked at the patient, reflected on the patient, and then organized regularly a discussion with me. Can be done online, where you sort of, we do this more as a sort of a mentoring thing, a discussion. Look, I've got this really interesting patient that I would like you to, would like to discuss with you. Is a patient that was complex, didn't know what to do. Then I did this, for example, and it was a great outcome, and I got quite surprised. Or it could be just a nightmare patient, and I don't know what to do, and I would like your, opinion on this. So the idea is you look critically at your clinical practice, kind of make some notes, pick up a patient. Okay, this is actually an interesting patient. It's not a kind of writing a big report. Is about like building a small portfolio where you sort of, summarize the patient, for example, clinical presentation, what you found, and then your plan of treatment, and then have a reflection about that patient, okay? Why is this important? In some countries where the profession is regulated, there's a requirement for people to do continuous professional development. So, for example, I'm still registered in the UK, and I have to demonstrate every 3 years that I've done at least 90 hours of continuous professional development. And a big thing of that continuous professional development is self-reflection, is about, identifying where my needs are in terms of knowledge, in terms of competencies, the way I want to develop as a professional, reflect on that, do a course, have a chat with a colleague, sit down over a coffee with a few colleagues and discuss a case, reflect, make some notes, put in our portfolio. So what are we doing here is not getting you to kind of go in a supervised clinical practice, but looking at your own practice with a lens of, that's interesting. Oh, I got quite surprised. I really did a great job. Oh, what happened here? What kind of thing happened? What is the mechanism? For example, or I struggle with that person. There's something I couldn't connect. What was missing? Well, maybe my communication skills need some improvement, whatever. So I'm just kind of getting you to think about, that. So it's nothing that is, yes, can say, oh, that's a lot of cases. Yeah, for sure. But, we have, this is over a period of time. We're talking about doing this over a year. And the important thing really is using your clinical practice as an ongoing kind of learning environment. So the patient give you an opportunity to continue learning. So that's the timetable. So one thing that, students hate, but at the same time drive learning, which is if you don't assess people, sometimes people don't learn. So there's a little bit of a carrot and a stick kind of thing. But of course, it's, the credibility of any higher education program depends also on how robust the assessment is, okay? So for each module, there are 2 points of assessment. And for the first module, I mentioned the advanced clinical reasoning and osteopathic care. There's an essay, which is a case report. Again, pick up an interesting case, write about that, kind of link to the literature. We'll go through this, explain give you examples of how the cases look like and so on. So it's that sort of case report, critical reflection on a patient and thinking about, the theories that may support your approach, the evidence that does or doesn't, and so on. Then there's the clinical assessment at the end of, in December. That's also part of the assessment. So you see there a new patient visit, but because this program is not done for the students that are actually on a 5-year pathway that actually have to do a real patient, what we're going to do is a simulated environment, multi-station simulated patient, just to kind of get you, assess you in that environment. The next module, the research, the research module does have a multiple choice assessment, which is, 1 hour and a half assessment with online. Okay, so you don't need to go to the Netherlands to do the assessment. It will be done in that particular day at that time. We release the online assessment, then you have the time to complete the multiple choice assessment, gets to the end, the assessment is closed, and then is submitted. So works that way, can be done from home. And then there's the research proposal. And the research proposal here, as I mentioned before, is the first part of your dissertation. So you can work with other people, you can work alone. Absolutely. That's both approaches are absolutely fine. And on the research proposal, what you have to do is, basically put a plan for your research after some discussions with the dissertation supervisor. What's your research question? What's your methodology? How you want to do it? As I've said, it's the first stage of the dissertation because the introduction and the methods will then be reused for your dissertation. Because if you continue this over a period of time, you've already done part of your dissertation, that introduction, that methodology. Of course, you can revise it, you can make it better later on, absolutely. But that's the sort of the foundation. So again, not making the dissertation, too complex, too onerous in terms of, of time and commitment from your side. Pediatrics includes an essay and a mini clinical assessment. So it's a case discussion done online, clinical reasoning, osteopathic management of that case, okay? And the essay is an essay based on the topic, kind of critical reflection in the field of pediatrics. So it's not a practical thing per se. And the sports care, the assessment is pretty much the same. Of course, what it changes is the topic being sports and the other one being pediatrics. And the final thing is the dissertation. So it's kind of ended up being, between 8 and 12,000 words. So if you can do a review, for example, a scoping review or a systematic review of the literature. You can do a primary data collection project, a qualitative study, for example, or a small, or a survey or a small clinical kind of trial, but not thinking about that I'm going to change the world and run this massive trial because that's not possible. But it could be, for example, a small pilot study in a particular area, providing that you have access to patients and the whole thing is ethical and can be done. So that's the nature of the assessment. And as I said before, the experience so far, working this collaborative, and we, because I've got a strong bias towards research. Quite a lot of people on the team have a strong bias towards research, not being kind of evidence-based gurus, okay? But, guys that will push you to think about, okay, challenge a little bit of the, some of the conceptual frameworks within osteopathy. And it would be very keen even to contribute, get involved in the research and contribute to, potentially a research paper, okay? So that's the thing, we'll try to push you to, can this be published? Is it good enough? So far, as I said, the experience, we can turn out, every year having at least, 2 or 3 students publishing research. It's a pretty good outcome. Start small, the profession needs some stuff, but needs some publications also with quality, and not just kind of published in journals that don't have much quality and what nobody will ever consider to be a valid thing. The final things, talk a little bit about the teaching team. So I said myself and Alexandre, the advanced research methods, myself, Nuno and Francesca, both of them. Nuno is a physiologist, happens to be my son, but there's no bias here. Is a physiologist and was also the delivering research until a couple of months ago at University College of Osteopathy. And Francesca is a data scientist, so she has got a PhD from Imperial College, and she she's a specialist in statistical analysis. The osteopathic pediatric care is Francesco Ceritelli from Italy. Probably few of you have read some of his publications or have done some of his courses. He's a close friend of mine and has been involved in teaching this program since we started the master's program. And Ruggero is an Italian osteopath trained in the UK. He's the only one on the team that does not have a PhD. He's a master's in osteopathy, but he's part of the teaching team and is extremely competent in the field of pediatrics. Sports care is Paul Bell. Paul is a British osteopath, graduated 21 years ago from Oxford Brookes University and did his PhD in sports care at University of Bath in the UK. And until a couple of months ago, was working in Singapore where he had 2 clinics, and is the guy that delivers the sports care in our program. And for the dissertation, depends on the size of the cohort, but primarily myself or Shand, and then we'll find also other supervisors to be second supervisors can help. Okay, so this is explanation about the program. So kind of almost like done the induction to the program as if you were already students. But I think it's important to at least you have information there. This as Yorick said to you, and at the beginning, this is recorded, so people can always go back to the recordings and kind of clarify any questions, any queries you may have. So at this point, I'll pass. I'll give the floor over to you and. Let you kind of ask, whatever question you may have, anything's not clear, and so on. So I'm here.
Does somebody have some questions?
Don't be shy.
I have one.
Yeah.
And, I did my osteopathy DO at FICO in Belgium.
Yeah.
But at that time, they told us if you want to treat children, you have to do some study afterwards. And that's the point where I started to think, am I going to treat children? I never treated one child. Is that a problem for the education?
No.
No babies. So I don't have any experience with this.
That's fine. So at the end of the day, the program, I've got an example. Give you of course, if we're talking about the experience of running this program so far, we've been running it with the Italian cohort of students that are on the continuum, their full-time education. So they have some experience of seeing the odd baby in clinic, with a tutor, but they don't have the clinical experience, and they do the masters. Also, we started at the beginning of this year, we started this program in Germany, and the 19 guys we have on the first group of students, some of them don't treat children, some are kind of very much on sports, some are on sort of a more generic thing. And it's not a condition that you need to have experience in pediatrics to do the course. It's a module, and the module gives you an opportunity to kind of learn skills, to kind of have some baggage. And then the idea is if you really like the area, then you kind of got a foundation, and then it's like off you go. And probably you would need, my recommendation then would be, nobody will become a specialist by doing a module on a program. It's about probably then, an extended period of practice, consolidation, doing further courses, and so on. It's a building block. In the same way, people don't work in sports and can they, I never thought about that, and then can use that. But for example, in sports, there's more of a transfer directly to, for example, musculoskeletal care. Whereas in pediatrics, you can say, well, do I fancy treating babies? I'm not sure. But that's okay. I've done the module. I'm okay with that. I can treat the mom, for example. I can do family practice, treat the mother. And maybe, okay, and the mother may say, well, would you mind having a look at my baby? Yeah, sure, why not? That's how it starts, right?
Yeah.
Kind of thing. Yeah, makes sense?
Yeah.
Okay. Leonor, you had something.
Is there a minimum amount of hours that you have to be present on the courses? Is there a minimum?
Ideally, attend the teaching blocks. That would say, okay. I would say attend at least 75% of the time. Okay.
Yeah. Okay.
That's the thing. Okay. Now, of course, if people, if people can't make one of the blocks for any extenuating reason, as long as not the whole block, ideally not the whole block, but you can skip 1 or 2 days. Absolutely. At the end of the day, it's also a master's program.
Yeah.
Self-directed learning is a big thing.
Yeah.
We just need to prepare. If people have that difficulties about sort of also informing us and say, look, I can't do that day. I would appreciate, you guide me on whatever necessary. It could be that, what we do, maybe we record the lesson, we do it, in presence there, but, we find a way of recording and send to people. That's also a way.
Okay.
Okay. I think Leonora was going to ask something, but she'll come back.
Yes, I have another question.
Sure.
There's an online learning system before the modules.
So there are some, there will be, as I said, there will be some pre-recorded lessons that I'll send, okay? And probably also together with that, maybe a couple of papers to read, okay?
But it's how many hours would that take before you join the week, for instance? Is that a lot of hours, or is it just
no? It's no. So if we're talking about and then you can watch the lessons before, or you can watch afterwards. It's not a, it's not an absolute requirement. Okay, they will probably maybe suggest, okay, look, we're going to do this as an introduction to the next thing. Right? It would be valuable that and I will try to do. So, for example, we'll try to do some of the lessons, that pre-recorded stuff that may take 30 minutes or 40 minutes. So people can actually watch that, even download that, put on, on a mobile phone or iPad or whatever, and watch on the move or when you have a break in clinic. So it's about that. And then we supply also a few papers people can read.
Okay, that seems okay. But then, because I'm working full time, and then there's a study of 2,500 hours in 18 months, as I read it.
Yeah.
So
Okay.
Can you tell me about how there's 1,500 hours for the theoretical part?
No,
that's quite a lot. How do you?
No.
How should I see it?
No. It's a very fair question. Now, what happens is, when you're talking about 90 ECTSs, you're talking about each European credit transfer. Okay. The European credit transfer system, any credit is worth 25 hours. 25 hours of student effort. Okay. That's not the same as 25 hours of sitting in a classroom learning stuff. Okay. So if, of course, you multiply, let's give you an example. A typical full-time education is 60 credits per year. 60 credits is 1,500 hours of student effort per year. Now, if you ask every university student if they spend 1,500 hours learning, quite a lot of them say no, nowhere near. Maybe some of them do much more, but that's the kind of the rule. So if you put the 90 CTSs, you're talking about 2,250.
Yes.
The teaching you've got is the teaching I showed you on the blocks, plus some additional pre-recorded lessons, and then your clinical practice. Okay, because on the program itself also talks about 360 hours of clinical practice. Now you are in full-time clinic. Okay, and what I mentioned to you was also in your full-time practice to look at, select a few interesting cases you've got, okay, pull them aside, it could be like, once a week, you say you go through your patient list or you make a note, okay, this is a really interesting one. I'm going to pull this, and over the weekend, I'm just going to go a little bit through, maybe I put some notes, maybe I collect the evidence, case notes and so on. And then over the next 2-3 weeks, you actually develop, because the person may come to see you next week and maybe in a 2 weeks time or something like that, and use that. And that process is learning. And you could then, as I said, you can then ask, me, for example, get in touch, by email and say, okay, can we have a chat? Can we organize, a quick meeting, 15, 20 minutes, sort of online, and have a quick discussion about the case? So that's learning. Of course, what you're doing is you're not just doing your normal clinical practice. You are, but you also sort of keep the radar on, looking for kind of challenges, interesting. It shouldn't be just finding complex stuff that you don't know the answer for. It could also be about finding the really rewarding cases and saying, this was great. I really enjoyed it. Okay. Let's celebrate, how I did it and, how it worked and so on. So that's part of learning. Okay. Then, of course, if you're working on your research project, supervision, you've got 10 hours, but then the rest of the time is you on your own or with your colleagues, looking for papers, kind of, discussing the ideas and so on. So the hours in total is the learning, is not classroom, because no masters will deliver 2,000 hours in a classroom. Doesn't work.
Okay, but still, 2,500 hours is
yeah, absolutely. But there's nothing. So the teaching you've got is those 3 blocks of 12 days intensive of 7 hours a day. Yeah, by the end of the day you're knackered, and by the end of 6 days you even worse. And then by the end of the second week you kind of don't know what to do. But that's intensive, okay? And that's the nature of the beast, let's say. And then of course you consolidate, you go home and kind of preparing for the assessment and sort of putting notes, discussing things, getting some collaborative discussions with colleagues and so on. That's all learning. So the thing here is thinking about, where do I see as an opportunity for learning, rather than just I have to be in a classroom, watching a guy or doing some stuff which I didn't enjoy. It's about, where is the opportunity for learning? So getting you to develop that critical mind, kind of inquisitive mind all the time. Yeah, make sense?
Very good.
Good. Leonor.
Hi. Good evening, Professor George. Thank you very much for your presentation. I'm Portuguese, as you may have noticed by my name. And I was very interested in your program because I recently finished my graduation in osteopathy. I'm a physician also with 25 years of practice, general practicer. This is my main point, which is I'm starting now this clinic, osteopathic clinic, which is something that somehow I feel I don't have practice enough to understand or might to understand or to follow the program, I guess, because somehow you need to have some years of practice or some patients, a number. I don't know the number, but you need some hours of practice just to. And this is my problem, I guess.
Okay, right, but you've got 25 years of working as a physician.
Yeah, it's a little bit different, I guess.
What's your specialty?
A general practitioner. I was devoted to emergency department for 16 years. So it's a little bit different, I guess.
It is a little bit different, but at the same time, you've got, as well, general practitioner, you really got that experience of dealing with all sorts of patients, simple, complex, knowing what the challenges of clinical practice are. So now you're entering a new field, which is osteopathy. And I think what is quite interesting, what is quite, I guess, one thing you can use as an advantage is to celebrate that sort of, dual role as a physician and now as an osteopath. How can you kind of merge two things, sometimes with a little bit of antagonist kind of a,
I'm starting feeling
perspective.
That. I'm starting feeling that.
Because one world's, when you think, very biomedically, where's the pathology, I'll fix that stuff, versus the other one, well, people have symptoms, sometimes don't have pathology, but they need help and so on. And so looking from that perspective, actually, I think that's something that, needs to be celebrated and needs to be sort of pushed as a sort of a uniqueness here. So I don't think I don't think I wouldn't be too worried too much about, okay, look, I've got enough experience or not. I guess you continue working as a physician, right?
Yes, but I have quit the national health system for a few years to dedicate myself to the osteopathic studies.
Okay.
It was an
That's
option.
Fine.
I had to make an option.
Absolutely. Okay. So, you can think, okay, either this is, too early, or, it's maybe I take this and there's an opportunity to sort of, give me a few more tools to sort of, on my entry to the profession now, actually maybe be a little bit better equipped in areas maybe I didn't cover at undergrad level, because that's normal. The first degree is really to equip you with the competencies to do stuff. The second level is to make you, a sort of a thinker, let's say, and someone a little bit more critical. So I think that's not, I wouldn't see that necessarily as a sort of as an obstacle of not doing the master's program. So it can be done, right? Within, if the worry, for example, is, okay, can I have enough patients, to reach those numbers and so on? It's not a kind of a rule that I'm saying, look at more or less about this, rather than saying you definitely need to have 25. Okay, there's a flexibility built in the system, okay, because ultimately what I'm interested in is, your ability to engage in that process of learning, to demonstrate that actually you kind of achieved the learning outcomes of the program, you kind of progressed in your profession, in your kind of, in your clinical practice. That's the main thing. So I think, and also having the diversity in the group is also quite good, because it's something that's, sharing with colleagues on the course and so on can be quite beneficial. I'll give you an example of, we run, have been running the bachelor program in Saudi Arabia, and we're going to start next month, actually, the masters for the guys who did the bachelor to continue on the masters. There's one individual that is a thoracic surgeon there, and he's kind of retired now from the health care, the National Health Service. And he's opening his osteopathic clinic. He's converted completely to the world of osteopathy, and they still call him for, some thoracic surgery, some complex cases and so on. But the very interesting thing is, he says, sometimes I'm kind of, operating on a patient with, lung cancer, and kind of my palpatory skills enable me actually to put the hand and kind of finding sometimes the tiny things that I couldn't find anywhere in any other way. So that sort of, diversity is what we're also looking for. It's not like one size fits all. Everybody's going to look the same, and then we have a group of clones. I hate clones, so I like people that are independent kind of thinkers, have their own mind and can kind of challenge and so on. So a brilliant class for me is like when people start challenging. Oh, that's interesting. What kind of? It's not a one-way system. Otherwise, it's super boring. So. Yeah, something to think about. Where did you graduate from in osteopathy?
Cruz Vermelha. Okay. When or where?
Sorry. No, where? Cruz Vermelha.
Cruz Vermelha. Red Cross. Sorry, Red Cross.
In Lisbon.
In Lisbon, yes.
Okay. Good.
Thank you.
You're very welcome.
When we subscribe for the program and we have to write our thesis, we need to do research and reading a lot of papers. Most of the papers nowadays are free access papers, but some of them are you have to pay for them. When we are subscribing, do we have access by over the university to get these papers?
we subscribe. Yeah, we subscribe to a few journals, not a lot, but we subscribe to a few journals. The other thing that I'm also able to get the papers that are published by Elsevier for you guys. So it's a question of also, asking me the kind of, I can't find this, and then we'll, find a way of getting those papers. Of course, people find other ways of
there are some
retrieving
Russian
papers.
sites that also
there are some Russian sites, but I can't advertise that, of course. Okay?
No,
It's
no.
illegal in the European Union, and but also, you know, there are other ways. You know, even for example, people subscribing to ResearchGate, creating their profile on ResearchGate, and then asking the researcher directly, "Can you please send me a copy of your paper?" Most people would send the copy of the paper because it's in their interest that you read their research as well. So absolutely. So yeah, there are ways around, and it works okay. It could be that the odd paper is very hard to get, but you know, in general, you know, we get them. Yeah.
Thank you.
You're welcome.
One more question.
Sure.
Maybe it's a question for you, but also for Rhei, some part. You told about the Master of Science for if you want to start teaching or if you want to go into research. But what's the value of this EQF7 level Master of Science if you look at the evaluation of osteopathy in Europe, for instance? If you want to go to start working in Portugal or in Italy or in France, where osteopathy is more recognized than in Holland, for instance, you need a Master of Science program. Is this valuable then? Or is
okay, so yeah, so some countries don't require the masters to enter the profession. So the only country, as far as I know, that require a master's to enter the profession is Switzerland.
And also Portugal.
No, Portugal, no. Portugal, the entry is a bachelor program, is a 4-year full-time program. So you need to have a 240 CTS program to enter the profession. If you have that, you have a 4-year degree, then you enter the profession. Of course, if you've got a master's, you can say, I've got a master's, okay, you should enter the profession anyway, you should get the registration. Italy profession just became fully regulated now, and there are actually only 3 years to enter the profession in Italy. It's going to be the country in Europe with you know, the lower number of years in the lowest number of years in kind of education, because the system, you know, put osteopathy under prevention and not under, for example, rehabilitation. But is exactly the same number of years, the same type of degree as the other health professions except medicine. And also there's one thing that in most countries in Europe where the profession is regulated, osteopaths work as a primary contact practitioners. Italy, the only person is a primary contact practitioner is the physician by law. So Portugal, for example, osteopathy is a non-conventional therapy, but osteopaths have the right to work as primary contact practitioners, so they can evaluate the patient, they can decide on the treatment plan, they can do whatever they want. Of course, if that's not for them, they should refer the patient to a doctor, but they have professional autonomy. That's the same, for example, in Italy, in Malta, for example, as the same in other countries where professional is regulated, the UK or Norway or Denmark now, for example. Okay, so the master's program, so this is the postgrad program, is not a program to enter the profession.
No.
Okay, so for example, for Switzerland, if you've got a first degree, a bachelor degree, and you are registered in one country with that degree, and if you do the master's, they will look at the program. You know, we have some Italian students that finished the master's and have applied for registration, and at the moment is under evaluation. We don't know if the Swiss system will kind of accept it or not, because they have their particular rules. Okay, so I can't advertise here that for sure if you want to go and practice in Switzerland, this is going to work, because it may not work. Okay, so it's kind of a unique systems that we need to take into account. So it's primarily a postgrad program. So I guess if you want to work in a country, it requires a bachelor, and you have a DO plus a master's, and they have no restrictions. You know, if the system says, okay, this cannot work as a compensation, you could use it. So if you say, okay, you need a degree, and I offer you evidence that I've done a program of training plus a master's, it could work okay in theory, so it's a higher level versus the other one. But each country is unique, and has to be studied in advance and say, okay, I want to go there, is this going to work or not? So it's even ask the authorities about that to start. That's the best way of preventing that problems later on. Say, well, you promised me that, and then I can't promise anything, because then might come back to haunt me. So, okay. Okay. Is anybody else?
No, I think we got a lot of information and a lot of things to think about. Thank you, Georgia, for your explanation. And
you're very welcome.
So this is recorded. We will put it on our website. People, if they want to, you can listen to it again, and maybe we have a second meeting later. Later this year.
Absolutely.
Okay.
Yeah. Absolutely. Let's do it that way. Okay. Thank you for your attention, guys. Okay. It was a pleasure.
Thank you.
Thank you.
Okay.
You're
Have
very
a nice
welcome.
evening.
You too.
Thank you.
Bye-bye.